Hello friends, welcome to the channel where we talk about elderly care, caregiver self-care, where we create the supportive community to share tips and experiences and build connections with like-minded people. My name is Slava Kreynovich. I'm a nurse practitioner and I do house calls. Throughout my practice, I've noticed that educating my patients and their caregivers about physiological processes in our body helps them not just to follow my recommendations, but also to feel more encouraged to do what's right for their body. When we understand why we're doing it, we're more likely to do it. Drinking water is essential for maintaining good health and well-being. Let's talk about the key benefits of it. So, hydration. Water is crucial for many physiological functions. It supports digestion as it helps to break down food so that your body can absorb nutrients. It also helps prevent constipation by keeping the stool soft and facilitating regular bowel movements. It improves physical performance as proper hydration enhances endurance and reduces fatigue, making physical activities more effective and less strenuous. Water helps to regulate body temperature through processes like sweating and respirations. Water helps to regulate body temperature and prevent overheating. Dehydration can lead to tiredness and decreased energy levels. Drinking enough of water helps to keep feeling more energized throughout the day. Adequate hydration helps to keep skin moist and may improve its appearance by reducing dryness and promoting elasticity. Water helps the kidney to filter waste from the blood and excrete it through the urine. Staying hydrated helps to prevent kidney stones and urinary tract infections. Drinking water also aids in weight management, as it can help control appetite, increase the feeling of fullness, which will lead to reduction of overall calorie intake. Dehydration can impair concentration, memory, and overall mental performance. Drinking enough of water helps maintain cognitive function and mood. As I mentioned before about kidney function, water helps to remove waste products and toxins from the body through the urinary system, reducing the risk of complications associated with toxin buildup. Adequate hydration helps to keep cartilage in joints lubricated, which can reduce the risk of joint pain and discomfort. Overall, proper hydration helps maintain blood volume and viscosity, which is important for optimal cardiovascular function and blood pressure regulation. Ensuring that elderly individuals maintain good hydration is very crucial for their health and well-being. As we age, our sense of thirst may diminish, therefore making it easier for us to become dehydrated. Let's talk about some tips to help manage hydration in older adults. Regular hydration. First of all, you should try to encourage your client or your relative to drink water throughout the day rather than only when feeling thirsty. Setting the reminders or developing a routine might help. There are certain medications that contribute to the problem of dehydration, such as diuretics. So talk to your healthcare provider about medications and how to manage side effects if they occur. Monitor intake. Certain people might need 6 cups of water, others more, less. That often depends not just on your level of thirst, but also on such medical conditions as heart failure, kidney failure. So talk to your healthcare provider to ensure what's your optimal amount of fluids a day. And then set that amount in one container in the morning. Watch for signs. So you have like a measuring glass, measuring cup for yourself, and make sure that you finish it by 6 p.m. This way you will make sure that you stay hydrated throughout the day while allowing your body to avoid extra fluid before the nighttime to prevent those so-called bladder colds at night. It's very important to watch for signs of dehydration, such as dry mouth, dizziness, dark urine, or confusion. If these symptoms occur, increase fluid intake and call a healthcare provider. I also would like to add a few more strategies to make it easier and more appealing for elderly individuals to drink more water. Add natural flavors to water, such as slices of lemon, lime, cucumbers, or berries. Herbal teas, hot or cold, could be also a good alternative. Also, if your client or loved one is not diabetic, you could add to the water, let's say 3/4 of cups of water and 1/4 juice, anything that they might like. Try to stay away from caffeinated drinks as they are diuretics and they're not hydrating. Offering a glass of water during the meal or during the walk can be a good routine that will encourage your client or your loved one to drink water, as this would become a habit over time. Incorporating hydrating foods in client's diet is very useful, as soups, stews, certain fruits like watermelon can be a substitute for drinking some amount of water. Also, vegetables such as cucumbers can be also used as alternative to drinking water. Encourage social hydration. By drinking together, it might encourage patient or a client or your loved one to drink more water or to drink more fluids than they would do when they're alone. Often sharing a drink will make it more enjoyable. Also, offering a drink with different temperatures, hot, room temperature, cold, might help you to figure out which temperature of fluids the older adult would prefer, and therefore drinking more. Encouraging small frequent sips rather than drinking large amount of water at once often helps the older individual to stay hydrated better. Utilizing cups or bottles that were designed for ease of use, such as with easy grip handles or built-in straws, will make it more enjoyable and more manageable for older adults to stay hydrated. And the last reminder, try to educate your clients, your loved ones, why you keep nagging about having them drinking water, any type of fluids, because they will appreciate that extra attention. They will remember something about your explanation. Just tell them about all the benefits we've talked about today. See what's more applicable to them, what will be more appealing to them, and talk to them about it. I compiled a summary of all my tips and recommendations that I've talked today about improving hydration in older adults, and you can find the link below. And just a reminder, as always, joyful heart is the best medicine. I'm wishing you and your loved ones good health. Be well. This is all for today, and I will see you in my next video. Take care.